So how many of you knew that chiropractic care can help assist with reduction of possible seizure activity for individuals that have seizures? Yeah, it's pretty interesting, isn't it? And a lot of times we look at one sort of methodology is greater than the other one, but it's not always the case. It's more of always trying to improve the health of everyone that is suffering with seizures. And we're going to talk about today with a lot of different of more of my clinical experience as well as a lot of research. I know a lot of the research is going to be very front heavy, so I'm actually going to go through it pretty quick because I know a lot of the expos today and a lot of the information you're getting is going to be a lot of research based coming at you almost like a fire hose. So I'm not going to do that to you because I want you to be able to take away more of the clinical experience of what we have in our offices and how we've been able to help so many different families with whose children or adults have seizures. So, quick disclaimer, this presentation is offered as general information purposes only and is not only to be relied upon as medical advice and or for the diagnostic or treatment of any purposes. Okay? So, who am I? I'm Dr. Kevin. I'm a neurologically focused chiropractor. We focus on taking care of the nervous system and chronic health challenges. I've given over 75 community lectures in my area. And then also I'm a Focus Academy doctor. What that does gives me advanced certification in neurodevelopmental disorders. So when I finish my chiropractic education, I continue to learn on about how the brain develops, because I'm sure all of you can agree with me, chronological age does not always equal developmental age, correct? Yeah. So we're able to go through and see where there's possible gaps in development, how we can fill those in so the individual can start to thrive and start to experience more of life. And like I said, this is the 5th year that the center has been speaking at the Epilepsy Awareness Day. And I have this approach in our office that is different among many other approaches, where it's called salutogenesis. Saluto meaning Latin root for health, then genesis, creation of. So not necessarily focusing on the factors that are causing disease, because I believe that we're designed to be healthy and not sick. Do you agree that we're designed to be healthy, that we shouldn't be living in a diseased world, that there must be something going on that's leading us to live in that way, correct? Yeah. It's going to be a lot of information, okay? Don't want you to feel free you need to take a bunch of notes. You can actually find me at my booth or even in the back after this. I will leave some time for some questions also. To also give you more of the research, give you more of the articles, the books, and everything I've been speaking about today, okay? But first, I want to start with Kai's story. Kai actually, today is his birthday. And when he first presented to our office, his mother drove all the way from Florida to San Diego to care for her son in our office. When I first met Kai, he was having 14 to 15 grand mal seizures a day. And after the first 2 weeks of care, he reduced down from the 14 to 15 to 2 a day. So huge, drastic change for his self and also for his mother. And the biggest notice that we had for Kai was there was a lot of instability in his upper neck. He had very low muscle tone to the point where he couldn't even lift his head anymore. He was a year when I first met him, and he was only able to lift his head up a little bit, and then it dropped completely down. So there was an inability for him to maintain his posture. I'm going to talk about how structure affects posture and also a lot of the different controls we have in a little bit. And then as we continue to take care of Kai, there was a point where we actually got 24 hours completely seizure-free. And then, unfortunately, due to circumstances, they had to move back to Florida. So we found them a chiropractor in Florida to be able to take care of Kai. And now he's doing a lot better. He's gaining a lot more of the muscle control in his neck. And he's also has continued to have reduced seizure activity. Last time I spoke to Mom, he was having between 2 to 3 seizures a day compared to the 14 to 15. And I also promised her that one day I would speak at the Epilepsy Awareness Day Foundation, actually the Epilepsy Awareness Day, to share Kai's story. So that's why I want to start with Kai's story to make sure I came true on that promise for her. And then some case studies that we've had in our office. We've had over 25 cases, but here's the 25 that we've had documented. And we've had 9 that have been completely resolved of seizures. 11 or 44% had significant improvement, and 4 had slight improvement, and then there's 1 that had no change in seizure activity. And a lot of times what we see too, 80% in total had significant or complete resolution of seizures. And then also the resolution was seen in grand mal, partial complex, atonic, and absent seizures. So all different types, and also some that are more genetically disposed, as well as other structural and as also physical traumas as well. Now we saw all changes in with all of those as well. 1 in 3 individuals who have epilepsy have uncontrolled seizures because treatment options don't work. 6 out of 10 people don't know why they're having seizures. And a lot of times we want to blame the brain for it. That this is from the Epilepsy Foundation, that the human brain is the source of human epilepsy. I like to look at it possibly a different way. That it's not necessarily the brain that is causing it. Yes, the activity is taking place, the electrical signal souls, the shorting that's taking place is happening in the brain. But what if that individual has a healthy brain, it's just not able to process the information that's getting to it, that's then making the seizure happen, almost like a reset button? Because I had a couple individuals that I take care of. One woman, her name is, oh my goodness, why am I blinking right now, is Nina. And she always says when she feels like her seizure's coming on, it's almost like a reset button for her. And then she was having between 3 to 4 seizures a day, or 3 to 4 a week. Now she's having 1 a month. Usually occurs around her menstrual cycle. And we'll talk about a little bit why that is too, looking at inflammation that builds up in the body that can lead to these as well. So what if it isn't necessarily always just due to blaming the brain? Because what does your brain need to function? What does that need? We need our fuel, so we need that glucose. We need to have the ability to remove toxins from the brain as well, because if all those toxins are sitting up in the brain, it's not going to be healthy for us. We also have to have the ability to remove them, to nourish it, and also be able to detox as well. So here's what we know. Individuals who have seizures have altered blood flow into the brain. I also want to look at this upper cervical structure here, where it's going to be a lot more research and study looking into the upper cervical spine and how it actually is possibly related to seizure activity. Because when we look here, this is our upper cervical spine, the cervical cranial junction, where we have the occiput, which is the base of our skull, the first 2 bones, C1 and C2. C1 and C2 are one of 3 bones in the body that actually have its own name. C1 is Atlas. Does anyone who Atlas is? The mythical creature? Holds up the world, right? Do you think our brains are a world for us? So that's what the Atlas does. It supports and holds up our head. And then the axis, it actually is allowed to have the range of motion for the cervical spine to have so much range of motion, because our neck has the greatest amount of range of motion. So in that region, we also have the most possibility to have stress due to the range of motion, the unique anatomy that we have that's taking place. Then we also have our spinal cord that travels up through our spinal cord. And then the vertebral artery, which supplies about 20% of the blood into the brain, specifically going to the cerebellum. And then when there's possible compromise there with looking at the blood flow, we can see here it travels up alongside these transverse processes that actually hold the vertebral artery in place to make sure that it's there for protection. And it actually travels up and it goes around the C1 bone, goes through a hole over there, and then goes up into the brain. And when it goes up into the brain, we also see the vagus nerve. Does everyone know about the vagus nerve? Yeah, it's a very big studied nerve within epilepsy, especially the vagus nerve stimulators. Those are a really great intervention, and also looking at what those structures look like. This is from Dr. Ross Hauser, looking at those nerves and how they are related to the spine. So when we're traveling here, I usually stand up for my talks. I'm going to stand up. So when we're looking at this here, we have the vagus nerve, which travels in front of that C1 bone. And when it's traveling in front of that C1 bone, could you imagine what happens when there's even just a little bit of pressure that's put on that nerve? What do you think is going to happen to it? If there's pressure on it. What was that? Yeah, it's going to crimp it, right? It's not going to be able to send enough information. There was actually a study done that looked at the amount of pressure that it takes as the weight of a dime to cause 40 to 60% of nerve interference taking place. Would you like to function 40 to 60% less effective? We should be functioning almost nearly at 100%, correct? Same thing happens to these nerves. And as they travel up, the vagus nerve, which goes through here, if there's rotation of that upper cervical spine, it's also then going to put more pressure there too, which can have detrimental effects in the body. And here's another side view of it. This is looking at it from the front, and this is looking at it from the side, so looking at how it travels across between those 2 bones. And then looking more at the blood supply. This is a closer view of it, looking at it from the front, and seeing how delicate those structures are and where it travels through. And then here's a nice little anatomy picture looking at this as well for the very delicate structures that take place there, and all the nerves, the veins, the arteries, how important it is, and how it actually goes up into the cerebellum as well. And I talked about the vertebral arteries and what they go to. They go to the circle of Willis. The circle of Willis is part of the brain, of the blood supply to the brain, that supports more of the cerebellum as well as our temporal lobes. And you can see as it comes up through here, the vertebral artery goes up and it hits into the basilar artery, which is then going to supply more blood flow and blood supply to the certain parts of the brain that control a lot of our balance as well as our speech and also our frontal lobe, which is more for our higher functioning capacities. So you can only imagine if there's rotation that takes place, it's going to put pressure on those blood flows. And then there's going to be more research showing that in these studies here, looking at how blood flow compromise was seen in individuals who are pre-ictal. So before they're having a seizure, they saw decreased blood flow into certain parts of the brain. So in this one here was looking at ipsilateral hypofusion, hypometabolism in 18 out of 20 patients. So before they had a seizure, it was recognized that they had decreased blood flow to that certain part of the brain. This study here was looking at also the arterial spin for the hypofusion in the thalamus, upper midbrain, and in the cerebellum in idiopathic generalized epilepsy. And again, more of the research showing that there was decreased blood flow to ipsilateral temporal lobes. Cerebral blood flow was significantly decreased compared to those on the contralateral side in healthy individuals. So, easy way to put it, I know it's a lot of medical jargon, I'm going to try and slow that down for you guys. There was less blood flow to the same side of the brain compared to the opposite side when they looked at individuals who had epilepsy, and then also looked at those who had controlled subjects, so individuals who had no seizures. And another one showing the same thing with decreased blood flow, interictal hypofusion, in the ipsilateral hippocampus, bilateral thalami, and the pericentral lobules. So again, decreased blood flow into the brain that's leading to possible seizure activity for individuals. And more research, 10 out of 12 people. Like I said, I'm going to go through this really quick so you're not inundated with all this research for you guys. I have all of it for you. Just find me at the end and I can get this all to you, okay? So here's what we know. Upper neck misalignment negatively impacts blood flow into the cerebrospinal fluid. And this is actually being looked at in medical journals and medical sciences, looking at how when there's misalignments of the C1, C2 vertebra, there's actually decreased blood flow into the brain. And then when that takes place, it can also affect the cerebrospinal fluid. The cerebrospinal fluid is there for our brain to gain nutrients, remove toxins, as well as cushion the brain. So if we ever have an impact, there is some cushion for our brain, so instead of just having that straight impact onto the brain, so it acts like a cushion as well. And then this is actually referenced with Dr. Scott Rosa, looking at functional MRI. So a typical MRI looks at a single moment in time and looking at the structures that are taking place. The functional MRI is actually looking at those fluid dynamics and see what's happening during the time, looking at the cerebrospinal fluid as well as the blood flow that's taking place in the brain. So in this one here, you can see this little black line. I know it might be a little bit challenging to see, and you can also see the pooling and the stasis of cerebrospinal fluid. So if we have all that fluid that's just sitting on the brain not flowing, it's going to make sure that it's going to allow the toxins just to remain on top of the brain. And this was after an adjustment. There is reduction of that black line there. You can see more of the fluid actually going through here again, as well as up into the different parts of the brain. We're seeing restoration of the cerebrospinal fluid. So anywhere we see white means it's higher density, so we're seeing more flow in those regions. And here's another image looking at the MRI, looking down on the brain, right? So looking down on the spine, looking at that C1 and C2, and looking at those rotatory misalignments. So in this one on the left over here, actually, your left, we can see that red line, it needs to be horizon, it needs to be parallel with the horizon. If there's any rotation on there, remember that previous image where I showed the blood flow? That's going to pinch off that blood flow as well. And this is the bone that's right below it, the C2. So those are almost going in the opposite directions. So when that takes place, we're going to put a lot of stress on that upper cervical spine and the blood flow that goes into the brain. And then here's one looking at it from the front, looking at that C1 and C2. The C1 needs to sit level on top of C2. And that's that little dens there for part of the axis that allows the pivot point to take place for that C1 to rotate on top of it. So we need to make sure that's level with the horizon as well. I want to share Elias's story. Elias actually presented to our office having between 6 to 8 seizures a day. And when I first met Elias, there was a lot of inflammation and stress on top of his head as well. Actually, the sides of his head protruded past his ears because there was so much inflammation that was up there. And this was last Halloween. Elias was a police officer. His parents were robbers. Both his other younger siblings were police officers as well. You can see one of the biggest things, a huge smile on Elias's face. He always enjoys coming to the office. And I'm actually going to have Dad share a little bit about Elias's journey as well.
Hi, my name is Margarito Corrado. I'm a father to...
Is everyone able to hear that? I know it's really low.
Coming to Chiropractic, to his office for about going on 4 years now. Our boy was diagnosed with tuberous sclerosis complex.
I don't think it's going to show that one. But what Margarito was sharing was Elias's seizure activity and how drastic it was. It was 6 to 8 seizures he was having a day. Now he has maybe 2 to 3 a week. Where there was actually a point where we got to 1 seizure in an entire month. And also he was sharing that Elias has been able to use an iPad for communication. He's nonverbal as well, and that was never taking place. Responsiveness to his name has increased as well. He's more attentive to his name. You say it, and he turns and looks at you, where before he would actually just blow right by you. Also saw that he was happier. He always comes to the office, big smile on his face, and he's also less self-abuse. He was notorious for hitting himself all the time, especially in the head. I personally believe a lot of children who are on the spectrum are releasing pressure on top of their brain because they're not able to communicate that they have a headache. So I'm pretty sure all of you had a headache at some point. Squeezing your head releases that pressure. So I personally believe that's what Elias was always doing, was trying to release that pressure that was up on his head to alleviate that pressure and stress that was up there. And he was also sharing that he's always treated like family when he comes into the office. And when he is there, we also listen to everything that's happening. Based on Elias's current state, how active he was, we also deter our care to that to make sure we're assessing all the needs that Elias needs, and also how the heat affects his seizures, especially in San Diego, and I know Orange County it gets pretty warm. Usually when we see higher temperatures, Elias's seizure activity increases. The previous years, before they started care, Elias was having upwards of 9 seizures a day due to the heat. And now he's able to get through a heat wave, having maybe 2 to 3 seizures over the weekend instead of having that giant conglomerate of seizure activity taking place in the same day. And this study here, looking at the loss of the cervical rotation and the normal spine curvature, can create downward traction on the spinal cord and brainstem as well. And then there's possible disruption of normal cerebrospinal fluid flow, impacting nutrition and support to the central nervous system. So in conclusion, the rotatory misalignments of C1 and C2 can impair the normal cerebrospinal fluid flow, as well as contribute to insufficient blood flow to the vertebrobasilar system. And here's more research. Like I said, I'm going to go through it really quick for you guys. Malformations and misalignments of the craniocervical junction can obstruct blood flow and cerebrospinal fluid into the brain. And then looking at 2 studies, or the study looked at 20 healthy individuals and what they were looking at when there was blood flow in these healthy individuals too. So there was a transient but significant change in middle cerebral artery blood flow occurred in subjects receiving chiropractic adjustments. So in these healthy individuals, actually in the chiropractic college, they tested the blood flow that was actually already taking place in their brain, and they looked to see what happened afterwards, and they saw there was an increase in the blood flow to those certain parts of the brain. And then how minor misalignment of the atlas can potentially injure or impair or compress or compromise brainstem and neural pathways. And also looking at blood pressure. On the average, with an individual receiving 1 adjustment, it showed that there was a reduction in 14 points in the systolic blood pressure and 8 points in diastolic blood pressure as well. So here's what we know. Stress is associated with epigenesis to increase seizure activity. So looking at stress and how it can be a chronic case for epilepsy later on in life, so 45% of the 38 total studies found higher cortisol in epilepsy than in healthy individuals. And seizures related to cortisol increased 77% of the 38 studies reviewed, and seizure frequency is related to a higher cortisol level in an individual. So looking at more of the stress, how or exposure to stress mediators has been found to increase epileptic activity in the brain and trigger overt seizures, especially right after repeated exposure. And then many studies now show patients with epilepsy consider stress to be one of those common triggers for their seizures. And then how an increase in early life stress primes more of these challenges later on in life too. Not necessarily just looking at epilepsy, but depression and anger issues as well later on in life for children. And also, so early life stress can elicit detrimental effects of hippocampal development by altering the HPA axis, neuroplasticity, and behavior. And that's where this study comes into play. This study looked at 128 children who were experiencing early life stress. And when they looked at these MRI of these children, there was actually significantly decreased sizes for their amygdalas and their hippocampus. And when that was taking place, so there was a smaller and a hippocampal volumes were associated with greater cumulative stress exposure and behavioral problems for these kids. So what does stress look like? Does stress ever go away for anybody? No, right? So what do we typically do when we have that stress response? We overflow and then we blow up. But what if we start to look at it a different way? So we have this bucket, right, that fills up our stress. When it gets that stress level, we lose it. But what if we start to look at how we can expand that ability to manage our stress and also put a spigot at the bottom so we can constantly release that flow of stress? So here's what we know. Individuals experiencing seizures have impaired autonomic function. I'm going to talk about a lot about autonomic function and what that is. And that's our central nervous system. And our central nervous system is going to control everything for our body without us even thinking about it. Because I'm pretty sure if you all had to sit here and try and remember to breathe, blink, regulate your skin temperature, pump your blood, all these different things, we're not going to last very long. That's why our body does it for us on our own. And then also the vagus nerve. What does it actually look like and where does it go? Vagus nerve is also considered the wandering nerve because it goes everywhere in our body. It starts up into our brain and it's going to travel down along our neck and it's going to our heart, our lungs, our diaphragm, our intestines, our reproductive organs, our stomach, our bladder, all of those functions. And that vagus nerve is what we call a parasympathetic nerve. Parasympathetic is that resting, healing, digesting, development, and repair side of the nervous system, which we need to be into so we can start to do all those things. The opposite side is the sympathetic nervous system. Has anyone ever heard of the fight or flight stress response? That's what the sympathetic nervous system is. So that's the fight, flight, or freeze response. So we can see it's going to stimulate our tear glands, it's going to dilate our pupils, it's going to increase our heart rate, it's going to increase the diameters of our bronchioles so we can take in more air, so we can start to recirculate that blood and make sure it goes to our big muscles so we can keep running from a hungry tiger. It's going to inhibit our stomach, it's going to inhibit our digestion, it's going to inhibit our bladder because when you're running from that tiger, we're not worried about going to the restroom. Very healthy for us when we are in danger. When we're no longer in danger, we need to go back to the resting, healing, digesting side, which is that parasympathetic, where it's going to act like a brake pedal on the nervous system. It's going to slow things down. So it's going to slow our heart rate, it's going to constrict our pupils. We don't need to take as much light around us. It's going to then also allow our stomach to digest our foods, increase the digestive functions of our stomach as well. So here's some signs that you have autonomic nervous system imbalance. We have the high sympathetic. We can see poor sleep and insomnia, IBS and diarrhea, irritability, anxiety, excessive sweating, manic episodes, focus and ADHD, and neurodevelopmental disorders. We can't live in that high fight or flight stress response. It's very energy demanding on our body, so it's eventually going to start to break down. And when it breaks down, we end up in a low parasympathetic response, where we can start to see constipation, depression, hormonal issues, chronic fatigue, fibromyalgia, thyroid problems, adrenal fatigue, immune compromised, brain fog, mood issues, memory loss, and autoimmune diseases. A lot of different things can take place when our nervous system starts to break down. How do we assess heart rate variability? Or how do we assess autonomic function? We look at it through heart rate variability. Heart rate variability in our office is going to be looking at your skin temperature, your sweat gland activities, and the intervals that are taking place between your heart rate all at the same time. And that's going to tell us the status of the nervous system to see where we're at. If we have a high heart rate variability, it means our body has the capability of going into fight or flight when needed and then being able to come back to the resting, healing, digesting. When it's abnormally low, It doesn't have that capability. It gets stuck in one side, and it's not able to get back to the other side back and forth as easy. And then here's more studies showing that decreased heart rate variability in individuals that have epilepsy. So these 20 children with refractory epilepsy, 20 children with well-controlled epilepsy, and 20 healthy children, they show that children with refractory epilepsy have abnormalities of autonomic nervous system dysfunction, so lower heart rate variability compared to the control subjects. And these studies showing the same thing from Epiplegia, 26 patients with medically refractory temporary lobe epilepsy and 24 controlled. Our results show greater autonomic nervous system activation in epileptic seizures than in the peripheral nervous system. And then we also, and from the same study, from the same book, we confirmed that extended hypothesis of sympathovagal imbalance in epilepsy. So an imbalance of vagal tone. The vagal tone is also looking at that parasympathetic side of the nervous system. So they had stressed vagus nerves. Their bodies weren't able to manage itself, and it saw an increase in individuals with their seizure activity. So here's what we know. Upper neck misalignments cause negative autonomic changes, and correcting the misalignment improves autonomic function. So in this study, what they were looking at was actually the stabilization of the C1, C2 instability through surgical means. So in these cases, it was more drastic that there was C1, so it's actually called axis atlanto instability. So C1, C2 instability. It could be from trauma, so there's a transverse ligament that runs across the dents that keeps things in place. There's also other traumas as well that can lead to instability of that upper cervical spine. So in the study, what they saw, once they fused these, after 5 years, they went and looked at the heart rate variabilities and saw that there was higher levels. Because there was more stability of that upper cervical spine, their heart rate variability was increased. And then adjusting the neck has a parasympathetic effect on the body. Here's 3 different articles and journals saying the same things, that the upper neck and the lumbar spine have parasympathetic effect on the body, and that the thoracic spine has a sympathetic response on the body as well. And this is Reagan. Reagan presented to our office. She has a condition called Rett's. She has a lot of seizure activity, a lot of hypertonicity, so her muscles are always super tight. They also have what's called the hand washing motion, where her hands are always just fidgeting back and forth like this. And also she's had a lot of GI challenges, a lot of acid reflux, a lot of GERD. Her parents taught her the sign language sign for reflux. So she would actually stick her fingers into her mouth, symbolizing that she had reflux. Every time Reagan comes into the office, we've seen a huge reduction in her seizure activity. She also does have a VNS implant as well. They have not had to use it nearly as often since they began care in our office, and also the intensity of what the VNS was set at, they had to reduce too, because it was actually overstimulating her vagus nerve to the point where she didn't need that. And with Reagan, every time she gets adjusted, she always has a huge bowel movement right after. Why? Because when she gets that adjustment of her upper cervical spine and the lumbar spine, it activates her intestines. It activates her stomach, so she's able to eliminate those toxins from her stomach as well. Because there's points where Reagan will not have a bowel movement for about 2 or 3 days. Does anyone know how often we should be going? 2 to 3 times a day, right? So if we're not able to eliminate those toxins from our intestines, that's all going to start to seep into our body and our bloodstream. And when that takes place, that's chronic inflammation that can take place as well, because we have to be able to eliminate that, and our body's natural response to do when it senses an invader is you create inflammation to go attack it, so they know where to go, so we're not just randomly attacking ourselves like autoimmune diseases. That's our body starting to attack itself, and they don't know why. So here's what we know. Clinical data shows that chiropractic care has an impact on frequency and intensity of seizures. So in these studies here, I'm looking at how upper cervical care to correct vertebral subluxation was administered to 15 patients, and all reported positive outcomes as a result of chiropractic care. And then here's more studies saying the same thing and sharing the same as well. If I go through all of them, we'll be here till next week, so I'm not going to do that to save you guys, and also to leave time for us to have some Q&A, okay? And then here's more as well. And one of the biggest things is chiropractic is a self-funded profession within the research. Since we don't prescribe pharmaceuticals, we don't get grants from the pharmaceutical companies to do research, as well as the government. The government's more looking into neck pain, low back pain for individuals within chiropractic, not looking at seizures, not looking at children with autism, not looking at all these other conditions, because typically neck pain, back pain is the go-to for chiropractic, when it is so much more though. So here's a case report that's in our office. This was a 24-year-old female who reported to the office with grand mal seizures that started around age 18. Keppra and folic acid reduced to 1 time a month and transitioned to absent seizures. And then there was a prior history of chronic migraines and headaches several times a week and severe fatigue. And there was difficulty focusing, so she was very spacey. And there was increased seizure activity with extreme heat temperatures. So in our office, we also look at parasthermal spinal thermography, looking at the skin temperature of the back. Our nervous system controls that as well, so when it's super stressed, it has the inability to manage its skin temperature from side to side. Anywhere you see a bar means it's warmer on that side. White's within the normal temperatures, green is mild, blue is moderate, and red is severe. So up in her cervical spine, the very top, she was 4 degrees warmer on one side compared to the other. So severe amount of cervical stress. Here is 6 months later. Huge reduction in that the heat that was up in there, and also there was restoration of the balance of her skin temperature from going side to side. And what we also saw, there was 1 absent seizure during the 6-month period. There was resolution of all headaches and migraines. There was increased energy. She was not as tired. And increased focus. There was no more brain fog. And then also able to handle warmer temperatures without relapse. So looking at what's actually taking place in the brain after an adjustment. So this study here was looking at the cerebral glucose levels of individuals who were given a task. It was a simple task, and what they did, they tested the blood glucose to see how much energy their brain utilized to do a certain task. They then adjusted them, redid that same task, redid the same test, and saw that their brains were more efficient. So the body and the brain started to become more efficient at doing the same task, so it required less energy. And also from the Australian Spinal Research by Dr. Heidi Havoc, looking at what's actually taking place when an adjustment happens as well, looking how it's taking us out of our reptilian cerebellar brain and puts us into our prefrontal cortex. There we go. And how it's changing by at least 20% of the activity. I love including this slide, talking about the side benefits of chiropractic, because a lot of times people come in, I don't have any complaints. Well, this review of literature is looking at all of that. So individuals who are asymptomatic, who had no complaints whatsoever, and they saw significant improvements in autonomic function, endocrine function, cardiovascular function, reduced labor times, all these amazing benefits for individuals who were having no symptoms whatsoever. I'm also going to include a couple more case reports looking at some of the other scans we do as well. So we also do static EMG, which is going to tell us how well the nerves are actually sending messages to the muscles of the spine. Red, again, is major. Black is severe. We don't see a whole lot of black a lot of time because that is astronomically high for what we don't want to see. So this was myoclonic seizures in a 32-year-old female. There was sudden onset of 15 to 20 myoclonic seizures during the 2nd trimester of birth, and then chronic history of migraines, and paraspinal thermography and static or surface EMG revealed extreme neurological imbalances. This is what her surface EMG her static EMG looked like after care. There was still a lot of stress in certain parts of the spine. That actually is the region that responds to stress in our spine. And we also saw that everything else started to calm itself down too. Here's that paraspinal thermography before, 12.6 degrees warmer on one side compared to the other. And this was afterwards, 2.4. There was still stress in that region, but it was a huge reduction of the amount of heat that was in there. I want to end with Elliot's story. Elliot came to the center having between 20 to 30 drop seizures every night. His seizures actually started to take place after they went to a trampoline park. It was about 2 days later that the seizure activity started to take place. They started everything else they tried, and they didn't see any improvements, and they started coming to our office. And after 4 weeks, Elliot went seizure-free. This was at the 6-month mark when Elliot was seizure-free, and this was 6 months later when Elliot marked 1 year seizure-free. And to this day, Elliot is actually still 3 years seizure-free. His parents and their family actually moved to Japan. And the first thing they asked me was, where's our chiropractor? Because they noticed the huge change that they had for Elliot. So we found them a chiropractor in Japan, because we want to make sure we find the correct people for you, because not every chiropractor is the same. And Elliot, again, like I said, he's still seizure-free to this day. And how do we find a provider? Like I said, we have different specialists within chiropractic. We have some that focus specifically on car accidents, specifically on sports injuries. You want to make sure you're able to find a chiropractor that is going to be right fit for you and your families or loved ones that you know that are suffering with seizures. So the first thing you want to look for is they should be vertebral subluxation based. If they don't have that on their website, you want to steer clear, because they're not looking to see the actual structure of what's happening in the spine. They're looking at that biomechanicals. We also want to use objective testing, so we can look at heart rate variability, the static EMG, thermography, and x-rays. If they're not doing any objective findings, they don't know what they're actually looking for. And experiencing more difficult cases. In some cases, having a child with epilepsy or with seizure activity, it can be pretty demanding on the body, specifically for the children, the families as well as the doctors. So if they don't have any experience with that, let's try and find someone else. And then pediatric cases, make sure they have extensive training in pediatrics. And there's a couple websites you can look at, the ifcochiro.org. You can also look at ICPA for kids. This is chiropractic.org. Those are all great resources for you to find a provider that's going to have a lot of this as well. You can also contact me. You can contact us at the Center for Health and Human Potential Facebook page. You can text or call us, and I have my number listed there. You can email us as well, and we can help find a provider for you, because we have a huge plethora of doctors that we work with to make sure we're able to help everyone all throughout the United States and over the world as well. So I want to say thank you. I left enough time for some Q&A, which is perfect. So I'd like to open up to anybody. Yeah?
If you have just a regular, you don't know, you don't know if they have training, can that still be somewhat beneficial or no?
Yes, great question. So the question was, if they don't have extensive training in this, and if we don't know if they do, would it still be beneficial? Yes, absolutely. To a certain degree, I won't be able to say, because each chiropractor is different, but it will have a huge benefit all over. Yes. Yeah.
Those testing tools that are here, are those very typical in a chiropractic office?
Wonderful question as well. The scanning that we do in our office is getting more and more popular within the chiropractic profession. It is not used in every office, but it is a huge one to be looking at that, because it actually tracks and gives you more objective findings as well. Everyone's going to start to feel better, but this can actually show what's actually taking place. So it is being more utilized. So the technology that we use is called Insight CLA. So if that's in there on anyone's website as well, that'd be really great, because they're looking at more of the objective findings as well. But yes, it is not necessarily used in every chiropractic office.
When you're treating somebody who's having active seizures, is the protocol like once a week, twice a week? How often is that?
Great question as well. In a more severe case, it wouldn't be surprising if we're seeing an individual 3 times a week. For the first reconstructive phases, because the body is going to want to go back to old patterns. So it's almost like going to the gym. We're not expecting the great results if we go one time. So we need to keep that repetition going to make sure there's stabilization of that upper cervical spine, because when we're walking around like this, as soon as you do this, your body wants to go right back to this. And in more severe cases, like with Kai, the little boy I shared in the beginning, I was actually seeing him 2 times a week, 5 days a week. He was coming to both my offices. We were checking him in the morning and checking him in the evening to make sure there was stabilization that was taking place.
Is it more cranking, or do you use like the electrotherapy mixture?
Yeah, so we use more, in most cases, I'm using my hands, where we're removing that structural interference. In some cases, if the child is more adept at being sensitive to something, we'll actually use a tool, it's called an activator, which is going to send an impulse into the body to alleviate that as well. There's some of the more severe cases we have in our office too, where even an auditory sound like that will trigger a seizure. There's actually a boy, his name is Isaac, he has Tay-Sachs. And that was what was shared with me when I came into the office. 'Cause I joined the office back in 2020, and I was told, yeah, before he wasn't able to lay down. Every time we would lay down, triggered a seizure. Every time we used the activator, triggered a seizure. All these different things were triggering them because his body was so hypersensitive. Now Isaac, he lays on the table all by himself with the assistance of mom laying him down and us having to do everything for him. But his seizure activity has reduced drastically as well. We're able to use the activator. The sound doesn't stimulate a seizure anymore. A huge reduction in seizure activity for Isaac as well.
So would you use that then instead of cracking if somebody doesn't like that?
Yep, we meet everyone where they're at. Some individuals prefer to use the activator. Some individuals don't like hearing the sound because that cracking that you're hearing is gas bubbles being released from the joints. A lot of times people think that the bone's actually making that noise, but it's actually the gas bubbles that are between the joints that are getting released when that takes place. So if I have a person that prefers, yep, I don't want my neck to be adjusted with the hands, we totally use an activator. In some cases, we use what's called the pillow adjustment, where it's actually a little drop table piece where the individual will be laying on their side, and then we place our hand to the correct segment of the bone, and then we drop that little piece to allow the bone to oscillate and put itself into place as well.
Is that as effective as using
It's still very effective, absolutely. That's actually what chiropractic was first found upon, was using more of a drop table piece. Looking at how it's called toggle, where it's you set the piece and the body is going to put itself into place as well. And in more severe cases too, like with Kai, I was not able to interject with my hands to a certain extent to make sure there was not enough pressure. We also use vibration, using vibration, especially for infants too. As I see a lot of babies, newborns, that come into my office just for general health checkups, and just making sure the amount of pressure that we use is like pushing on your eyeball with your fingers, the amount of pressure it takes to adjust a baby. Yeah.
You said you have 2 offices. What are those locations? Maybe I missed that.
Yeah, so both our offices are located in San Diego. One is in the Mission Valley right over by where Qualcomm used to be, and also one a little bit closer to Escondido. Maybe within the next couple of years, we're actually going to be opening an office here in Orange County to make sure we're able to save and serve people of Orange County as well.
And is it you at both those offices?
Yeah, I'm at both those offices. There is another doctor in the office that is further south. She's in the office with me. She's my chiropractor. I'm her chiropractor. So we got to practice what we preach. So I have to get adjusted as well because taking care of 150 people a week is pretty demanding on the body at points.
What type of training do you do to follow that?
Yeah, so the biggest thing is more of the extensive training after school. School doesn't train you for any of these cases whatsoever. So making sure that they have an advanced certification. And like I said, with the Focus Academy, I did that one. Also doing through the ICPA. You can also do Webster Certified. You can do other certifications to make sure that you're able to take prenatal as well as postnatal care for individuals too.
For the individuals that you showed, or any individual, once they find the relief, is this like a lifelong treatment, or is it ever where they don't have to go back to the chiropractor?
Great question as well. In most cases, we have not seen an individual have relapse after they've gone through the entire the recovery phase. Once we get through all of that, we haven't seen any relapse in our office. But a lot of times what we see for individuals, it becomes more of a lifestyle change, where it's not necessarily nearly as frequent. We're not seeing an individual 3 times a week anymore, where it becomes maybe once every 2 weeks, once every 3 weeks, once a month, just more of supportive care, almost just like going to the dentist. In the beginning, we wear our braces 24/7, it's nonstop. Then so when we get the retainer, it's more of that supportive care, and then after that, it's more of just general maintenance checkups. Did you have a question as well? Okay. Yeah.
If you have a brain injury at birth, does this still work for that?
Wonderful question as well. Yes. Our brain is plastic, so it's always trying to be better. It's always going to try and regenerate itself as well. To a certain extent, we can't necessarily say doing what type of brain trauma it was, but we can also make sure we're feeding it the proper things, getting proper glucose there so the brain starts to recover itself to see drastic changes too. We had a question back there?
Have you seen any patients with nocturnal epilepsy specifically?
Yes, that was one of the major things that Elliot had. His were all nocturnal. I usually started around 8:30 p.m. His was always starting. We also seen a lot of cases where children have their seizure activity with the cycle of the moon. And we also look at more holistic interventions looking at possible parasitic involvement. There's been some research showing that when there's possible parasites in the body, seizure activity can increase around the cycle of the moon too, especially a full moon.
You were starting to talk about the lady that had him around her menstrual cycle.
Yeah, so a lot of times what we see with the menstrual cycle, a lot of inflammation builds up in the body, especially around birth too. So the one case study I was sharing where the seizure activity started taking place the second trimester when she was pregnant, there's a lot of inflammatory processes that take place during those times. And when there's increased levels of inflammation, it's going to decrease the blood flow into the brain, which is going to lead to a lot more of those consequences too. So the upper neck is a major component of where we focus, but we assess the whole spine. Especially like with the picture where I was showing with Kai, I was actually releasing tension on his cranium as well as his sacrum. Those are the two bigger the flows for the cerebrospinal fluid. In our office, we don't necessarily start with the x-rays. In more cases, if we see if someone had a huge trauma, we'll refer out for an x-ray. After 14 visits, if we're not seeing any changes in our office, it's very rare that happens, we'll refer out for an x-ray to see structural changes that are in there, to making sure that, hey, like, is there possible structural imbalance here that's leading to more of these challenges too. In our office, we don't use our TENS unit. When I need, and I refer out to my specialist for physical therapy, because that's more their expertise, I refer out to those experts to give everyone the best care possible too. They're not going to be correcting the structural misalignment. When they're doing more of the massage, it's the just removing the toxins from there by stimulating the muscles, getting the flow that's taking place, but they're not actually correcting the structure that's actually in the cervical spine. Correct, yeah. Making sure we have the proper alignment to the spine so our body can start to function the way it's supposed to. In some cases, that does happen, where it's the next day, and that's where more of a severe case. I was talking about seeing an individual 2 times a week or 2 times a day in more and more severe cases. Usually we see the restoration phase being 2 times a week for about the first 3 to 6 months, in some cases 9 months, depending on how severe the case is as well.
As a follow-up to that, do you normally relax the muscles before you do an adjustment?
Yes. The biggest thing is I never adjust someone when I know their muscles are tight, because when you do, it's going to hurt my wrist, and it's not going to be comfortable for the patient as well. There's definitely techniques I have to relaxing someone's muscles. And 95% of the time, people will say they're nervous, but their muscles are more relaxed. It's more of the psychological saying that I'm nervous. But the muscles are going to tell a different story. Also doing, like I said, different tricks to relax those muscles to give me that slight opportunity to make sure I deliver the correct adjustment. Mm-hmm. Yeah. So we meet the kids where they're at. I never force an individual or a child to do what they're not comfortable with, and we meet them where they're at. Sometimes I'll adjust on the floor. There's been many times where I'm laying on the floor adjusting a kid. or even then they'll be in mom or dad's lap, or they'll be standing by our fish tank. Doesn't matter where they're at, because we can do the work that we need to do to make sure it's happening.
Questions. First, do you have experience or do you know about the benefit or impact on adjusting a kid with cerebral palsy?
Yes. There's a little boy in our office. He unfortunately passed away last year. He had cerebral palsy, and he was always moaning and groaning, unable to walk, always in severe discomfort. And his parents were actually told that he was never going to walk. After about a month of care in our office, he began to start walking. We had all these drastic changes for him because we restored the proper function of the nervous system. His body started to heal all the different avenues. We realized he had so much discomfort and stress in his stomach. That's why he's moaning and groaning all the time, because his stomach hurt. So once we relieved that stress part area to his body, it was able to get all those toxins out. So he started to function a lot better, became happier, always had a smile on his face. So huge drastic change for his life.
Second question, can you speak to insurance?
Yeah. So in my specific office, we're not in network with insurances, but if you have out-of-network coverage, we supply a super bill to allow you to get reimbursed directly from the insurance companies. There are some offices that do accept insurance. Necessarily, they may not be the type of chiropractor you want for those cases. There are some that are, though. That'd be the biggest thing, just vetting them out and seeing if they're in network. I can also, like I said, you can contact me. I can find the best people for you. But a lot of times with specialists, they're not always covered by insurance because it is a specific niche that these families or these children or these cases are looking into. I think I have 6 more minutes before I get yelled at. Yeah, so what I can do, you can contact me. I have my booth that's over there. I also have a paper up there. You can write your name, your number, and email. I can also get you a series of emails that's going to have a lot of this information for you as well. I have my booth, I believe it's 607, 608. I'm right next to, there's a CBD oil company that's right next to me. I'll be right over there. Any other questions? Yeah. Yes, Elias. That's Elias, actually. Yeah. Wonderful. Thank you so much, everybody. I appreciate your time.